Dr. Baldo, I'm wondering if you take a look at some of the T cells, are you seeing a difference in the people who are severely ill with COVID and the people who are either asymptomatic or have very mild symptoms in their T cell response?
It's interesting when we look retroactively or retrospectively at exactly that, T cell signals in people that did really well versus those that did very poorly. We actually do see differences. But the trouble is we're doing that retroactively or retrospectively. The question is, can we predict based on T cells who's likely to have a better or worse outcome? And we're doing that work right now to try to find what we call correlates of severity or correlates of outcomes as well. But there are definitely differences in what we call the T cell repertoire or the T cell signal between people who get very sick or unfortunately die and those who are able to clear the disease. But as Diana had pointed out, the heterogeneity, so in other words, the differences between individuals of this disease is absolutely tremendous. And so someone who potentially had a pretty mild case could actually have a very strong either antibody or T cell signal and vice versa. But in the aggregate, we're starting to see some trends in terms of correlations between severity and T cells.
And I think that really kind of begs the question of what kind of population immunity do we really have?
Mm. Yeah, and I have a strong belief on this, and we don't know the answer yet, and it's going to take some time to tell. But some combination of the B cells that produce antibodies and the memory B cells that kind of sit around and waiting for the next time you might get exposed, and or the T cells are going to ultimately hold that clue.